Hello, my name is Ramtin Hakimjavadi, and today I'll be presenting the protocol for a systematic review entitled Identifying Features of Effective EMR-Based Clinical Decision Support Systems for Addressing Potentially Inappropriate Prescribing in Older Adults. To give some background, older adults are particularly vulnerable to potentially inappropriate prescriptions given the unique physiological and pharmacological changes that occur with aging. And here, a PIP, or a potentially inappropriate prescription, will be defined as the prescribing of medication that could introduce a significant risk of an adverse event, in particular when there is an equally or more effective alternative with lower risk available. Clinical decision support systems, or CDSSs, implemented on electronic medical records, or EMRs, can enable automatic point-of-care application of PIP reduction strategies. There's an emerging evidence base of CDSS's role in influencing prescribing, deprescribing patterns at the point of care, but it's still unknown what features of CDSS design or implementation facilitate their effectiveness. And just to note that Epic, the EMR used at the Ottawa Hospital, is a leading implementer of EMR technology in Canada. So it will be important to study future CDSS implementation efforts on this platform. Our objective is to describe a protocol for a systematic review of EMR-based CDSSs for managing PIPs in older adults. Our primary research question, of several others, is what are the constituent features of EMR-enabled CDSS design or implementation that differentiate between effective and ineffective interventions? We will follow standard PRISMA reporting guidelines, and this review will be registered on Prospera once it begins, with any changes to the protocol being documented on the website. In terms of eligibility criteria, we will restrict to a population of adults aged 65 years or older. The primary intervention we're looking at are CDSSs for reducing PIPs. The comparisons we will look at, firstly, are CDSSs implemented on EMRs versus those on standalone computerized systems or web applications. And then within EMRs, we will further differentiate between those from commercial vendors, such as Epic, and unique EMRs developed for specific hospitals. Our primary outcome is an effective CDSS, which will be defined in a moment. And then for study design, we will look at experimental and observational studies with a comparator. The main databases we'll look at are PubMed, Medline, Embase, and Scopus. Our keywords are listed there. We will not use any date restrictions. However, we will limit to the English language. An effective CDSS will be defined as those where the primary outcome was reported to improve. And we will identify which CDSSs implemented features from a list of EMR-based features that we identified a priori through expert-driven discussion. We will test which EMR-enabled features are associated with effectiveness using multivariable logistic regression. And the remainder of descriptive analyses will be analyzed using simple statistics. In this systematic review, we aim to provide a comprehensive overview of computer-based CDSS for reducing PIPs in older adults, and we provide an analysis of the constituent features of these systems that differentiate effective and ineffective interventions. We hope that this will contribute to an understanding of how CDSS interventions can be optimally designed and implemented to improve medication safety for this vulnerable population. And we hope that our findings will also inform these interventions for EPIC at our hospital. Thank you.